Welcome back to Ask the Educator, a podcast for all professionals involved in medical device processing and sponsored by Healthmark Industries. The education team here at Healthmark has 280 years of combined experience in areas ranging from sterile processing, endoscopy, OR, biomed, to hospital and industry leadership. Our goal is to leverage our collective experience to answer one of your questions each episode, giving you the practical tips you need to succeed in the evolving world of device processing. My name is Kevin Anderson, clinical educator here at Healthmark, and I will be your host. Let's get started. All right. Hello, everyone. Welcome back to Ask the Educator. I'm Kevin Anderson, and I have with me Seth, Hendee, and Cheron, Rojo. Thanks, you guys, for joining me on this episode. I appreciate it.
Thanks for having us.
Thank you.
All right. So for this episode, I really wanted to address the question, what is insulation testing and what do I need to know about it? So if you would, Seth, just give us some background. What is the purpose of insulation and what types of instruments do we need to look out for insulation in particular?
Absolutely. Insulation is just a barrier. You know, we need to use electrosurgical devices to do a lot of internal cautery now, laparoscopic procedures, a lot of brain surgery, neurosurgery is done that way as well. And you know, what's happening is there's a generator creating some electricity, and we need it to enter at a very specific spot of an instrument and exit from a very specific spot. And the insulation is what makes that happen. It allows it to come through the cord, either into a monopole or a bipole, travel down the instrument, and only exit at the tip. Now, the thing that we have problem is, you know, if it doesn't, we start to have issues, right? If that electricity comes out where it's not supposed to, those are the issues. And as I say, if you're talking laparoscopic, you find, you know, it doesn't matter which size, 3 mil for PD stuff, 5 and 10 millimeter laparoscopic instruments. But then a lot of people also don't think of their bipolar forceps, jeweler's forceps, and things like that. They're not all black coated. Some are black, some are blue, some are pink. It really doesn't matter, but you'll be able to feel that the instrument has a particular coating that's keeping that current in.
Excellent. So, Cheron, why is this insulation so important? Is there some risk that we all need to know about to our patients that we would like to share with the audience?
Yeah, of course, Kevin. You know, it's not just a risk to patients. I mean, patients is the obviously number one here, but it's also risk of burning the surgeon, burning the surgical team. Surgical suite fires have been documented with the drapes catching on fire with the bipolar or monopolar cords. But then you also have the patient that can have internal burns inside that really won't be noted or really know what's going on until after the fact. So they go in for a laparoscopic procedure. Everything goes great and fine, only because that surgical view is only like 10% of what you see. Then 6 to 7 days later, patients having nausea, abdominal pain, a variety of symptoms to come back and do an open. And when you come back to do an open, then they realize when they're in that they see adhesions every which way. Just recently, last September, I had a close call or a scare with my daughter who was 8 at the time, 8 years old. And she had a laparoscopic procedure. And I did ask the surgeon, you know, do you have any concerns? And I said, well, yeah, you know, do you guys do insulation testing and a variety of other things? And the answer was no. And of course, I was scared. I mean, now I have to make a choice as a parent. You know, do I put my daughter through this? She's already in pain. And this was almost like an emergency. Her appendix was gangrenous, and decided to do so. But 6 to 7 days later, she started having the same symptoms that I'm aware of. And of course, what did I think it was after the surgeons telling me they don't insulation test? So went back. It turned out that it wasn't that. It turned out that it was just her appendix was gangrenous and the infection was left over in her body. But still, that left me thinking, oh my gosh, I mean, my daughter's one of many children, adults that are having procedures here and they're not using insulation testing. So again, those are the big issues. And again, a lot of these things are documented. So
yeah, I thank you for sharing your story, because I think that's something that, you know, the average person going to take their loved one into surgery or going for themselves, it's not something they really think about. They might think about, oh, is the surgeon any good? What's their reputation? What's the facility's reputation, right? They might think of that. Not even everyone thinks of that, right? But unfortunately or fortunately, we have some inside knowledge and we worry about those things because we know the risk is that there's a possibility that those adjacent organs could inadvertently get burned and the surgeon not even be aware of it. And so if we don't have those practices in place, we could miss it. So getting to those practices, Seth, could you share with us a little bit about what is the insulation testing procedure and, how often should we do it? What does that look like?
Sure. Well, let me say, protect these instruments. I'm going to talk quickly about testing and that kind of stuff, but in transport is when these instruments are most at risk, okay? And so segregating them away from other metal implements in trays designed to hold them from banging around. This insulation is delicate. And so we have to treat it that way. We're so used to dealing with some rugged stainless steel things that this insulation can't fight against those. So segregating those instruments, treating them nice is the best way to prolong them. Even if you're doing that, what do we have to do? Well, really, if these instruments are used with a current being passed through the length of the instrument, our performance qualification, our PQ, should really be doing the same thing. So there are plenty of devices out there that now let you hook this instrument up and run a current down through it. Thankfully, this is current that, if you're wearing gloves, as you should, you'll be fine. If you weren't, you maybe get a little tingle in your fingers, but this is safe current to perform testing, but is actually simulating what's happening with just a much smaller voltage. And so you hook up your instrument and you pass it down, through an accessory, and you listen. You listen for a beep. You look for a light to go off. Depends on what your tester is, right? Depends on the functions. And then okay, I have made contact with all 360 degrees of the insulated surface, and the entire length, and in no place did this go off where it shouldn't. So this insulation should be intact. Now, if you want to talk about how often, there are things where a lot of times nowadays we'll say, do a risk assessment through your facility, things like that. Well, if you were to do a risk assessment, you would think every time, but I want to point you back to some IFUs, and Cheron's going to talk a little bit about how standards are really saying this isn't something that you make up. This is a delicate instrument. This is a specific function, and it should be checked every time.
Right. So just as a follow-up question to that, Seth, I just thought of it is, should a tech be doing this and sitting and they're going through their tray, they actually do detect a leak where it's not supposed to be? What is their recourse at that point? What should they be doing with that instrument?
Absolutely. It has to come out of service. Insulation, for as delicate as it is and is important to the function, is actually fairly easy to fix. Most of your third-party repair companies can fix the insulation. Please take a look at that because if they do it poorly, it can shrink, and you can actually have a repair job that can cause issues as well. Usually at the distal or the proximal tip, when they don't do it right, you get some shrinkage and then you don't have full coverage. But most of these instruments are fairly easy to repair. And if you find damage, it should absolutely come out of service and not be used until it is repaired.
Excellent. So with that being said, Seth, you had alluded to it, but Cheron, you're going to help us out because I think ST79 has something to say regarding insulation testing, but people may not know about it. So I thought you would be able to give us an update, if you will, on ST79 and maybe other standards and things that we should be aware about that speak to insulation testing.
Well, I'd like to start off, that ARN already had something in there in regards to using some type of tester to test your insulated devices. So ARN already had something in there, and it does currently. Even AST, Association of Scrub Technologists, they actually had something they call it a insulation scanner. But it all is the same thing, right? Amy currently doesn't have anything specific to insulation and basically just has, the overall, inspecting your instrumentation and such. But there is a new amendment coming out, which I'm not too sure if it's past that 15-day review and it's going into publication or where it's at, but it's at the tail end of it. But it is a new amendment that's going to be in 8.2, 8.1 that's going to cover the inspection of insulated instruments. Basically, it's going to go a little bit more detail of the inspection and the integrity testing. So two separate things. Some of the things I can highlight that are going to be really unique and really good for the user is the fact that it's saying in here to use enhanced inspection, not just magnification, enhanced. Because standard magnification doesn't work when you're looking visually. You just can't see it. Also, they even say, using a borescope as well. Now, we're used to borescopes going down a lumen, but borescopes can be used on the surface, and they're very much enhanced, as well as, testing every time. That's like what Seth alluded to, is that it kind of makes sense, right? If it's used once, it could be damaged. But Amy is, being a little bit more clear of what should this look like? It should be every time it's used because, damage can happen. The other thing that it goes into, which I really, really like, is the fact that it's going to be referring to a table. In the table, it's actually going to give key points of certain types of instruments. So the focus historically has been on laparoscopic, but laparoscopic can be robotic. There's other instruments like forceps, scissors that are insulated as well, cables and cords, which is one of the biggest ones that cause OR fires. But it's a really good table that really tells you the instrument. It tells you the inspection points. It'll go over possible damage and then goes in methods to assist with that inspection. One of the things that I will definitely tell you that I think is interesting is that it calls for enhanced magnification microscope. That's unique.
Yeah.
That's unique. So not everything fits that specifically. So again, stressing that, this is going to be really a great section amendment. It also even goes into pictures as well. So not only will the table have this, there'll be pictures to back up what you're actually looking at to help the user.
So it sounds like, to kind of recap what you're saying a little bit, is that ST79 is going to have some more specific language coming out very soon, but AORN already speaks to it. AST already speaks to it. And what about our device IFUs? Are we going to be able to find sections in there that talk about insulation testing?
Yeah, there's a few IFUs. I mean, there's many. I can't really quote all of them. But the ones that I had to pull up in regards to, like recently for a presentation I was doing, and Seth has done the same presentation as well, it does say to test with an insulation tester, or won't be very specific. Some IFUs will just say to inspect and then tells you to look for cracks, pits, So again, it's kind of all over, but some do specifically say an insulation tester. It goes as far as saying every time it's processed. Some just say use a tester, but it doesn't tell you the frequency. So it's kind of all over.
Excellent. Well, I mean, I think what is important there is that we do have guidance on it, even if it's not 100% all the way out from ST79. You do have IFU guidance, you do have AORN, you have AST. Plus, hopefully, if you understand how the insulation works, it's something that you're going to want to do and implement at your facility. One thing I want to get to before we run out of time, because we're already getting close, is Cheron, you had started a little bit of your own study on this. So I would love for you to share a little bit about what you did and what you were finding during this study that you were doing.
Well, currently I'm working on a preliminary study. This was all pre-COVID in 2019 of a year of going to facilities across the country and collecting data with my own testing of trays that were either sterile or they were backup or just coming out of the washer. And in that study, it was really scary because it would turn out a quarter to a half to even 3/4 of the instruments in let's say a laparoscopic tray was actually damaged, or the insulation. The other thing that I found is that the type of insulation tester they had, because there is different levels of them, some are very sensitive and some are not. They were using them correctly, and the frequency was every time. The issue is it wasn't sensitive enough to where when I was using installation tester I was finding 3 to 4 breaks when theirs found 1 or none. So even though the customer or the user themselves were thinking, hey, I'm doing great, it wasn't. I also found out in the study, looking over the data, that it was also the technique and the type of accessories that were being used. Some facilities were using the right tester. It was sensitive. They had all the accessories needed, but the technique, meaning the technicians were going so fast that they weren't catching at the distal tip when normally it goes off at the distal tip because it's metal. They weren't finding breaks there. Or the accessories were broken and damaged, and they were using damaged accessories. So the data actually saw numerous issues and not just one. When I started, I thought, I'm just going to find, one, meaning, they're not using a tester or they're using a tester, whatever. And it's not all these other issues. So that surprised me, but I'm currently working on something now. So soon to look out for that in 2021.
Excellent.
Can I just...
Yeah, Seth, please.
Sorry, just to throw in, I love that Cheron mentioned that. If you have a tester with a battery, just a 9-volt or 2 AA's, you will have experienced this, that you're testing and not finding too many leaks. And you're like, it's been a little, I'm going to change the battery. And all of a sudden, you find more laparoscopic items in your bin, and it's in your repair bin. And it's because batteries die. And as Cheron said, they're not as sensitive. And so we're doing the test, and yet we're still missing. It's tough.
And Kevin, just to add real quick, in my perspective, and I know Seth is the same, just our perspective, being on the user side, you should actually be installation testing when the instruments come back from repair, like Seth had said, because you can have a bad repair job, and when you actually find a damaged one and you're replacing it from your backup. Because in my study, I found the backup is one of the worst ones because damaged ones were being put back into backup and not a repair bin. So it needs to be tested when whatever you're replacing with. Just wanted to end with that.
No, that's excellent. Oh my gosh. Cheron and Seth, thank you so much. I feel like we gave people a whole lot to think about, a whole lot to digest in a very short amount of time on a very, very important subject, insulation testing. So thank you again, Seth, and thank you, Cheron, for joining me with this one and sharing your experience and expertise. I appreciate it.
Thank you, Kevin.
Thanks for having us, Kevin.
All right, just to recap this episode, I spoke with Seth Hendee and Cheron Rojo about the important topic of insulation testing. We discussed the following key takeaways. 1, insulation on instruments is there to protect our patients and staff from unintended electrical strays. 2, insulation can be damaged through normal wear and tear. 3, breaks in insulation could lead to injury or surgical fires. 4, insulation testing and inspection is key to preventing potential injury or fires. 5, insulation testing is supported by guidance documents from AORN, AST, and soon to be included in ST79 through an amendment. And lastly, it's important that if you currently use an insulation tester, that you know it is working properly, so you may need to change batteries or send your unit in for calibration. If you have any questions about your insulation tester or need to implement this testing strategy in your department, please don't hesitate to reach out to your local HealthMark rep. I want to thank you all for listening. Please remember to subscribe to our podcast so that you are notified every Thursday as new episodes are released. All opinions expressed on this show are those of the presenters. Before using any medical device, it is important to review the device manufacturer's instructions for use.